We're here to experience the joy in serving others and serving those that aren't as fortunate as we are. And we're so lucky and just blessed that we get to work at a company where we can turn around and do a lot of good. We first came into contact with One World Health in 2019, and Michael was trying to sort of articulate, what they did and all that sort of stuff. And you got it pretty quickly. It was building hospitals and developing areas, and so we signed on to try to help with that. We thought that would be pretty neat, but I had no idea it would. I had no idea seeing the scene today is what this would lead to in just about 2 years. And the scene was, people that were just ordinary people, but in desperate need of healthcare, getting to see that they were getting help and knowing that we had a part to play in that was just a really neat thing.
This is home.
How are you feeling today?
Awesome, man, because this is almost down and this week, but a little bit tired. But when the people's out from our services and his face has a smile, I feel so good because I think I doing my job, but not my job like the doctors, actually my job like a serving my God.
Today, we are providing free health care to this community. We are providing treatment for common conditions for women, children, and men. We are also providing family planning counseling, cervical cancer screening. We are providing laboratory testing, and we are also providing medication for patients.
There are a lot of people that are not getting the health care they need, sometimes not because they can't afford them, but because they are not available near their hometowns. And so they have to go like 3 hours away from their hometowns, or if they are available, they are very, very expensive.
And so the idea behind the hub and spoke is that the hub will grow into a hospital, a full regional referral hospital, and then there are outpatient facilities and a little inpatient kind of scattered in depending on demand that will see patients closer to their homes, and then have a place where referrals can come back for bigger surgical cases, inpatient care, all kinds of that stuff.
One World Health is bringing those three things together, addressing affordability, addressing sustainability of health services, addressing quality of health care. And I just feel that it brings together all the things that I want to see happening in this in our health system.
We thank you for the gift of life. We thank you for our colleagues who have traveled all the way along from the US. We thank you for the health care services they have provided in also construction of this facility, which is giving health support to the community.
Insight Global believes that people can learn anything and people can build sustainable careers, and to see that One World Health has figured out how to bring sustainable healthcare to a place like this wow, was really cool. It's like they are the, we are the One World Health of staffing, and they are the Insight Global of developing third world healthcare.
We recognize now we're up to 19 facilities across the globe now,
Oh, wow.
between 3 countries. And we're treating around 150,000 patients on an annual basis, about 250 staff. Again, not everybody's local, which is it's really important to us.
Yeah.
That's part of our commitment going forward, and part of our strategic vision is that a minimum 90% of our staff will always be nationals.
Yeah.
We'll be identifying and investing in local talent, which is really cool.
One World Health is definitely creating a lot of job opportunities, you know, to those who are related to the medical field. And even non-medical field related people are being blessed with the opportunities that are being opened through the opening of a clinic, through the medical outreaches, like interpreters, you know, the transportation providers, the food providers. We have all kinds of people being benefited by having a One World Health clinic or outreach around.
This really is sort of what I would say a generational change. It has generational impact. So bringing affordable care to communities, including my own community, which is not very far from this one, really means that people can start to develop their homes, develop their families, and break that generational cycle of poverty and, delayed development, really.
3, go!
Love it like radiant diamonds bursting inside us. We cannot contain.
What's your name? Lindsay.
Your love will surely come find us like blazing wildfire, singing your name. God of mercy, sweet love of mine, I have surrendered to your desire.
It just feels like this is our purpose. It's a very permanent feeling. It's a very permanent sort of thing. I get asked sometimes the questions like, Bert, what are your financial goals for the company over the next 5 to 10 years? But that doesn't mean a lot to me, and at the end of the day, it's sort of like all that's sort of meaningless unless I think you apply it to some really good use. The only problem is I don't know how to build hospitals in Uganda. I don't know how to bring healthcare to the developing world, but we met these really wonderful people at a firm called One World Health, and they know how to do it. And so we get to step up and be the financial engine, right? That can help them go do what they do best, which is bring healthcare to different parts of the world. And so like the need is just now, it's now. And so it's important that our people give. It's important that our people show up and they give with their service hours, that they give with their time, and they give with their money. I'll just be very, very, very clear. This company is ready to step up and give as much as we need to, the company itself, and I think if our people can do that with us, man, we can just make this world such a better place.
Like blazing wildfire, singing your name. Your love is like radiant